Welcome to the Longevity Optimization Podcast, where we discuss longevity, optimal health, nutrition, peak performance, cognitive excellence, and so much more. Dr. Sanda, it's such a pleasure to have you here with me today.
Thank you, Kayla. I'm excited to be here.
We are going to be talking all things biological dentistry and my optimal oral health routine. I'm so excited.
Yes, I can't wait.
So first, what is biological dentistry?
I'm glad you're asking me that because so many people have that question and you're going to get different answers. But biological, and that's the kind of in the name, we choose materials that are compatible with our biology that will not make us toxic. And then we also take into consideration the whole body, not just the hole in the mouth.
Doesn't that seem like something that all dentistry should be?
Yes, I agree with you. It should be all like that because the mouth is not separate from the rest of the body. But in school, and I went to dental school at The Ohio State University, we're really very much focused on the mouth alone.
Yeah. Well, I love that. I mean, it makes so much sense, but unfortunately, it's just not where everyone is at. I always call it the functional medicine of dentistry. I don't know if that's a good analogy, but there's so many different levels, right? When you see let's say a doctor or a provider of some sort, there's such a vast discrepancy. You know, some people might just immediately prescribe, and then some people want you to do advanced labs and really get to the root cause of what's happening. And that's what you do. And I love it. I mean, I came in and I had like a full assessment. How long are your initial new patient assessments and what are you looking for?
Yeah, a great question. And by the way, I do like the analogy to functional medicine because you're right. We personalize the level of care. So the first assessment for a new patient, it can be up to 3 hours.
Yeah.
And the reason is we're trying to assess the oral microbiome. That's the first step for which we do a test. That test is a salivary test. And after that, we take a 3-dimensional CT scan because we want to look for potential inflammation in the jawbone. We want to look at the health of the sinuses. We also want to look at the back of the throat to see the airway, the breathing, and evaluate how well someone sleeps at night. And then, of course, we also evaluate for cavities. We evaluate the bite to make sure the TMJ is in the proper position.
Most, if not all of which, you would not typically have assessed at a normal dentist appointment, unfortunately.
That's true.
Yeah.
You're right.
I mean, there's an interesting link even between like the width of our mouth, and it's so much more complex basically than we're being told, I think. The oral cavity, the oral microbiome.
It's true. Some people actually don't have even enough room for all the teeth, or the mouth is too small. The tongue is all the way in the back. They cannot breathe properly, and then the whole posture is affected. So there's so much more to oral health than just oral health. It affects the whole body.
Can you talk about what you see when it comes to the oral microbiome? Like, what are you testing for? What are you finding? And why is the oral microbiome so important?
Being a periodontist by training, I always was interested in like the oral microbiome. And we've learned so much more since 20 years ago when I graduated from UCLA periodontal program. Today, we look at the bacterial fingerprint in the mouth. The reason why is because certain microbes that cause bleeding gums also affect the way we think. It can create brain fog. It can affect the unborn baby. It can affect the joints. There are certain microbes that are correlated with rheumatoid arthritis, let's say. So by treating the bleeding gums, we can help someone with their overall health. So that's why it's so important to test for the oral microbiome. And this is one of my missions, to educate dentists out there to test more of the oral microbiome.
Yeah. Is there like a common pathogen that you see more so than others?
Yeah. So from the oral saliva test that I do, called the oral DNA test, we look at 11 different types of pathogens that are contributing not only to gum disease, but to overall health issues.
Yeah.
Out of those 11, 4 of them we call aggressive. And they are linked to systemic health problems, and some of them even to cancers.
Interesting.
So if somebody has one of the 4 aggressive periodontal pathogens, we do an oral microbiome reset or a full mouth disinfection in order to reset that balance that maybe they've carried with them since they were kids, perhaps from their parents. They inherited a not so optimum microbiome.
And can you explain more about the link? Because I think, the link between cardiovascular disease and some of these bacteria in the mouth has been pretty well established. But how is that mechanism working? Why is something in your mouth affecting your cardiovascular system or your brain?
One of the bacteria that's related to heart attacks, called AA from the Actinomyces species, has been found lodged in heart valves. So what happens is, we call it more aggressive because as your gums bleed, it can get inside the blood vessel and it catches a ride.
Okay.
And it goes, and the immune system doesn't necessarily see it. And then it lodges itself in different parts of the body and also on the walls of the blood vessels.
Wow.
So when that happens, it creates an inflammatory reaction, which actually causes these blood clots to occur.
Wow.
From rupturing a plaque and inflammation.
Yeah.
And that's the link. So inside the plaque of the blood vessel walls, we have found periodontal bacteria. So we know there's that association. There's also been cadaver studies looking at inside the heart after they passed away, and they found AA, for example, the Saccharomyces species of bacteria lodged on the heart valves.
Wow.
So we know that periodontal pathogens, or people suffering from gum disease, have 2 to 3 times more of a risk of cardiovascular problems.
Wow, that is very significant.
Yeah, and it can be preventable. That's the amazing thing. With a easy procedure, it doesn't have to be surgery. I always say, as a periodontist, I rarely do gum surgeries anymore. We're more turning over the microbiome. And we're seeing that when we create the right environment in the mouth, people heal.
Yeah.
I think the worst time to do surgery is when the gums are inflamed, because you're just opening now the pathway for all this bacteria to drive deeper into your body.
Oh, wow. Yeah, that makes a lot of sense.
Yeah.
Is it the same situation with the brain? So it's essentially entering the blood and then moving to the brain? Is that what's going on?
Yes. One particular bacteria called Porphyromonas gingivalis, or P. gingivalis, has been written about even by, let's say, Del Bredesen, who wrote the book The End of Alzheimer's. Dr. Perlmutter talks about this particular bacteria because it's been found in the brain of Alzheimer's patients. So it does cross the blood-brain barrier, and we call it more of a stealth type of behavior from this bacteria because it can hide itself from the immune system.
How is it hiding itself?
It becomes invisible. It's got somehow a layer that basically our immune cells just don't see it.
Wow.
So it lodges not in the joints, but in the brain. And I would say 20 to 30% of the saliva samples that I take from patients, I do see P. gingivalis being present. Usually those are also the patients that say, you know what, I have brain fog.
Wow. That is very interesting and important. What would you say is like an optimal oral health routine in the morning? I mean, I feel like a lot of people just kind of wake up and like haphazardly brush, probably with like, I don't know, some Crest. Hopefully, I think listeners of this podcast probably have moved on to, a healthier toothpaste. But what would you say is an optimal morning oral routine?
Great question. And because I'm so passionate about the oral microbiome, I really have 3 steps.
Okay.
And full disclosure, I have a natural oral product company called Orasana. Based on natural oral products, we need to avoid harsh chemicals. Number 1, when we're brushing our teeth. But step number 1, brush with a calcium hydroxyapatite tooth powder or toothpaste in small circles. Second, water floss or floss, whichever one people want. The problem is a lot of times people don't floss correctly, so I recommend using a water flosser.
Once, twice a day?
2 minutes twice a day, ideally. And thirdly, pop in a chewable probiotic, especially for people that build more plaque, people that are prone to cavities, people that have a dry mouth, and then kind of spread it around, especially as a last thing before you go to bed.
I love that. I'm taking your oral probiotic, and I love it.
Great.
What do you think about tongue scraping? Is that important? And what do you think about oil pulling?
Tongue scraping is hugely important. And I always advise people to do an oral self-exam at home. It's essential. And what to look for, as you're looking around, stick out your tongue and look at the color of the tongue surface. Is it whitish? That's usually a digestive issue, maybe some yeast overgrowth on the surface of the tongue, some dead skin cells. 60% of the bacteria from the mouth can reside on the tongue. Especially for people that have bad breath, maybe the taste of food has changed. Highly recommend that you check in with your tongue. If it's nice and pink, don't scrape it. But if you have that coating on your tongue, a little whitish coating, definitely with a tongue scraper. It's hugely important to clean that, usually from the back to the front.
What if you don't have the buildup, but you just want to make sure you never get it? Is tongue scraping still okay?
Yes, you can do it, but you don't need to.
Okay.
It's interesting is my acupuncturist always says the tongue is a reflection of your digestion. And I always have this debate with her. She said, well, yeah, if your digestion's good and you're eating nice fibrous foods, your tongue should be kind of self-cleaning in a way. But I still think it's good to do tongue scraping. So for me, I always scrape it usually when I see a film on it.
That makes sense. What about oil pulling?
I actually looked into oil pulling and I looked at the studies that are out there, and a lot of them come from India because we know oil pulling comes from India. It's originated from there. It's an Ayurvedic practice that started with sesame oil. And why with sesame oil? Because that's the only thing they had 6,000 years ago.
Yeah.
It was inexpensive and available. Some of the studies were done at the university, at a dental school in India. And they looked basically to see how it compares with a mouthwash and an antiseptic mouthwash. And it was comparative. So it does help to get rid of bleeding. It's helpful for people with gingivitis, meaning bleeding of the gums, in conjunction with brushing. If you have gum disease, it's not going to get rid of gum disease. So it's a good adjunct, we call it, to your regular routine. A couple of the articles were actually talking about older patients that ended up with droplets of oil in their lungs.
Oh, no.
And they ended up with pneumonia because of the bacteria from the mouth now was living deeper. So it depends. These patients obviously had gum disease as well. So you have to be careful just not to inhale the droplets, because the correct way to oil pull is 20 minutes.
Yeah, so long.
It's a long time. And why? Because it takes 20 minutes for the oil to turn into a soap. That's what happens when you swish it back and forth.
Interesting.
Yeah. So that's why to do it correctly, it does take that long.
What do you think about some of the, I have like a red light device that you can put in the mouth, or a blue light. What are your thoughts on those?
I'm always cautious with blue light. I did my master's in oral biology at UCLA, studying cells. And blue light distorts the DNA or damages the DNA.
That makes sense.
So I wouldn't overdo it. And we know it's antibacterial, but I also say, do we really want to kill all the bacteria in the mouth, or just keep it, balanced? So I like red light, though. Red light is healing. It has a healing frequency. In our practice, we use red light therapy after healing. And especially it helps with the lymphatic drainage, and it helps to bring vascularity to an area where we're working, decrease inflammation. So it is beneficial.
I love that. What about traditional, we'll call them, conventional mouthwashes? I mean, this is like, for me, a hard no. What is it? I don't even know. The blue one?
Great. It's a hard no for me, too.
Oh, yeah. Okay, good. What is the blue one again?
Listerine.
Oh, yeah, Listerine.
So, before I got married, I had plenty of time on my hands, so I was playing around with a lot of like pH meters and let me see the pH of this mouthwash. It's very interesting that a lot of mouthwashes on the market are acidic.
Mm.
And especially Listerine, when I measured it, it had a pH of 3.5. That's basically the same pH as wine.
Yeah, wow.
But and then the recommendation is to swish it back and forth for a minute. Do we really want to swish acid on our teeth for a minute? No. I mean, what that does to enamel, it really creates porosities in the enamel. And in an acidic environment, the teeth wear down faster. And what I find, people with sensitive teeth, once they start stopping swishing with Listerine, they actually feel better.
Oh, wow.
So very important to find a mouthwash that's not acidic if somebody likes it. So why would you use a mouthwash, right? It's mostly for flavor.
Yeah.
I personally am not a fan of mouthwashes. There are some mouthwashes out there that are homeopathic. Let's say for people with dry mouth or some people that have sensitivity in their gum, that's okay to use. In our practice, we also have aloe vera-based mouthwashes that help with certain conditions, with healing after surgery, for example. But as an everyday mouthwash are not necessary.
Yeah, I love that because you don't want to be wiping out all the good bacteria also, right?
Exactly. Yeah.
That makes a lot of sense.
Yeah.
What about the great debate of fluoride right now?
I'm glad that more and more people are asking questions about what's really happening in our water. So fluoride, if we look at the science, there really hasn't been any articles to prove that fluoride in the water actually prevents cavities.
Yeah, right.
So how did it end up in the water? It's really as an agricultural byproduct.
Mm.
And fluoride itself is a toxin. It used to be, unfortunately, given to children to strengthen their teeth as a tablet.
Oh, wow.
We don't do that anymore, thank God. This was about 20 years ago.
That's horrible. Yeah. That's like a mega dose.
Exactly.
Wow.
And what it actually does, we know there are studies to show that it lowers the IQ in children. And topically, we have better options.
Yeah.
My favorite topical to strengthen teeth is calcium hydroxyapatite. In nano format, it goes into the pores of the enamel, and basically it's biologically sound. It mimics the mineral that comes out of the enamel, and we know it works because of the x-rays we can take and see the strengthening of the teeth.
Mm. Would you say that people, because of the lack of minerals in our soil and then subsequently our food, is that showing up in people's teeth these days?
That's a great question. There's definitely a lack of minerals, magnesium and calcium. These are all necessary things. Yes, definitely the soil is affecting our oral health, just like it is our overall health.
Yeah.
And because I think the pesticides that are in the soil, it's really affected a lot of digestions around the world. A lot of people have digestive problems, and with that comes an inability to absorb minerals.
Yeah.
And now we see a weakening of teeth from that as well.
Wow. So, it makes a lot of sense to me. To give a quick recap on the fluoride situation, can you just give an overview? I mean, from what I understand, it was essentially brought as an issue. I'm not sure exactly to who, but you probably know more. And didn't it take like a very long time, continual testing? Then the tests were presented and they showed that the fluoride was not proven to be safe. And then finally, it sounds like we're at a place where they're now saying that it's not safe. Is that right?
There was just a ruling, actually, at the Supreme Court level that the EPA finally admitted that, yes, fluoride is not safe. And these attorneys, actually, they did a presentation for us at IAOMT earlier this year. And I was so impressed with them because they've been at this for a few years. Mm-hmm. And they showed the testimonial from the EPA officers while they were being questioned. And they finally admitted that, yeah, from the studies we have, we know fluoride is not safe. But yet it's in the water. And I'm curious to see how long is it going to take it out of the water now.
Yeah, I mean, they give themselves ridiculous amounts of time. Like, no, this is immediate. It should have never happened. And you should be taking swift and aggressive action when you find things like that out. And also, I mean, it's a whole other conversation, but the fact that it's clear that they knew and they just kept, I mean, I think that there was even stories circling around that people wanted to keep upping the fluoride. You know, there was a story about this, like everyone called him a hero, this man somewhere in the middle of the country, and he was turning down the fluoride, I guess, in the water, and everyone was so excited. Yeah, it's really, truly amazing, the spot that we're in. We were just talking about, I was in Switzerland, and the regulations around, you know, our food, probably dentistry. Are the regulations around dentistry more strict in other countries?
Yes. And actually, a lot of the dental products that we use in our office come from Germany and Switzerland.
Yeah. I mean, this should really be a no-brainer. We won't go into the whole, like, I'm super passionate about this topic, but yeah, things that we buy on the shelves should just probably be tested for safety because people are consuming them at such high levels.
I agree. But I think, you know, we're at a good time at this moment for things are coming out to the surface.
Yeah.
Like the fluoride debate, definitely. And, you know, we have the mercury debate that's also very hot right now. And, you know, the European Union is actually banning the use of amalgam mercury fillings starting January, but it's not yet banned in our country.
Well, I mean, this probably should have been banned many years ago, right? So talk about the process of how you have to remove mercury fillings if someone has them. And obviously you don't do them.
Yes. I want to start by telling you my story. I grew up in Romania, and in Romania, in communist Romania at the time, I ate a lot of sugar. I didn't know what floss was. I ended up with 16 large mercury fillings in my mouth over the period of like 3 years.
Wow.
And I remember taking a fork and putting it up against my tooth, and it would give me a zinger.
Oh my God.
What is this? Have you had any mercury fillings in your mouth?
No.
Yeah, so it's an interesting feeling, and I didn't realize till later on when I was in school this was actually a current that was running through from the fork to my teeth into my system.
Oh, yeah.
Because anytime we have different metals in the mouth in a moist environment, it creates a battery.
Wow.
And that battery, I mean, I was not feeling well. And I thought that was normal. You know, I had headaches. I was always tired because this battery was stealing electrons from the rest of my cells. And stuff,
Yeah.
you know. So I decided, okay, well, I came to my periodontal residency at UCLA. I was in house my mouth.
Yeah.
So I asked one of my friends to remove them.
Mm-hmm.
Well, I didn't know anything about biological dentistry at the time. So he removed them. And I started to feel sick, nauseous, like I had brain fog. I couldn't do my hikes that I normally do in LA.
Yeah.
And I went to a naturopath. My mercury levels were off the charts.
Wow.
Because I had the fillings removed unsafely.
Yeah.
The mercury fillings or amalgam fillings are about 50% mercury. And when we drill into them, there's so many vapors that come off the tooth of mercury, and that doesn't have a smell, it doesn't have a taste, and we inhale it and it goes into our body. It's about 1,000 times when we drill into our tooth, into any mercury tooth, 1,000 times the levels that the EPA allows in the atmosphere.
Wow.
Yet all the dentists and the assistants are breathing this in.
Yeah.
The smart way to remove it, that's a technique named for safe mercury removal, protects the patient by having a little dam around the tooth and a big suction that suctions out the vapors and a nose piece on the patient. And basically the dentist and the assistant are wearing gas masks. It's that toxic when we remove it.
But why did they ever think if it's that toxic, it can go in the mouth?
Exactly.
This is totally ridiculous.
Yes. I don't know why they thought it was a good idea. 100 years ago, this is when it started.
Yeah.
And for me, the other problem was mercury fillings expand with time.
Okay.
And they crack teeth. So it cracked one of my teeth. I now have an implant.
Oh my goodness.
Yes. because I didn't know. I just like had these really, really big fillings.
Wow.
So it's so important. I think if anybody's looking at replacing, or they look in their mouth through their self-exam, they see anything silver there, to go get that taken out, because that's toxic.
Yeah, but taken out the right way.
The right way. Is this SMART technique is a technique that's validated by the International Association of Oral Medicine and Toxicology. And we know that when we use this technique, we don't increase someone's level of mercury in their body.
I mean, on the topic of finding the right way to do things, I had a wisdom tooth that I needed to get out for, I was aware of it for several years. I used to have a biological dentist back in Ohio, but I was really looking for an amazing one when I came here to LA, because I knew I needed this wisdom tooth out. And there's so many things that I was aware of that could go wrong. So, my biggest fear was a cavitation. From what I understand, if you remove a wisdom tooth improperly and you don't treat it, so you did the ozone and the PRF, which kind of filled it, and it healed beautifully. But I have heard of so many experiences of people getting cavitations, and you can talk more about what that is, with improper wisdom tooth removal.
Yes. This is another big thing that affects people's health, cavitations. So just like a cavity is in a tooth, a cavitation is a hole in the jawbone, also caused by microbes. So what happens when somebody has a tooth removed? A hole is left open. The mouth is full of trillions of microbes. Bacteria, fungus, pathogens, sometimes parasites. And as it heals, these microbes can go inside the jawbone. Some of them don't need oxygen to survive, so they can thrive just fine, especially they have nutrients inside the jawbone coming from the blood that's there. And the gum closes over the top of them.
Oh, no.
The bone takes about 6 months to heal. The gums really take a week to heal. So in that process of healing, the microbes that are caught inside, especially if those people that maybe have had wisdom teeth removed, then they remember getting a dry socket.
Oh, yeah, dry socket.
That's basically an infection of the jawbone.
That's horrible.
Yeah. And what's normally being told to patients, oh, you have a dry socket? Okay, well, here's a little syringe, fill it up with water and irrigate the bone until the gum closes on top. And that's really not a good solution.
Yeah.
Number one, through the use of PRF, which is platelet-rich fibrin, which we prepare by drawing blood and spinning it down in a centrifuge. It's 100% natural. There's no additives to it.
Yeah.
It forms a little jelly, and that little jelly plug, we put it inside where the tooth comes out of, and it really prevents dry sockets and bacteria from going inside.
Well, it definitely worked.
Yeah.
That's exciting.
Yeah.
To move on to, let's say oral longevity. I'm just throwing all these terms that I've decided here at you. So we did a little bit of PRF in my gums, right? So you, of course, did an assessment. We did imaging. And what begins to happen with our teeth and our oral health as we age, and how can we start to combat that?
Great question. Now we live longer, right? Our life expectancy is longer. And through having a healthy diet, we eat more fiber.
Yeah.
That fiber can be harder on our teeth, actually, because the fiber itself is great for the jawbone structure because it helps the jawbone develop better.
Yeah.
This is Weston Price studies. He looked at it in the 1920s, how, in the Amazon tribes, the jawbones were developed a lot better than the Westerners who were eating processed foods.
Yeah, exactly.
But the fiber itself can wear down the enamel faster. Especially, I'm noticing, especially my two upper front teeth, they're starting to become thinner at the edge.
Yeah.
So one of the things that we do for prevention, which I'm due to do that, is actually add some bonding to kind of biomimetically fill, kind of restore that tooth structure so I don't have more of my own enamel wearing down.
Yeah.
And really preserving the tooth structure. And also with the fibrous foods, we also have more gum recession. because it's harder on the gums. Also, brushing too hard can cause gum recession, clenching. And, today's day and age, with all the changes going on in the world, clenching comes with it because it's just the internal stress that happens at night. Clenching or grinding.
Yeah, I had a little bit of I feel like we got ahead of it, but it could have been moving in that direction. So we did PRF injections.
That's right, exactly, to help rejuvenate the gum tissue, to add the growth factors to keep the gum tissues from receding.
Yeah,
absolutely. So these are the things for longevity of oral health, or oral health optimization, as you like to call it. It's really important to look, okay, how do we strengthen the enamel and keep our teeth as long as possible? It's really through use of calcium hydroxyapatite, making sure, looking at the thinning of the enamel and try to restore it in the least invasive way. And then we look at gum health. Okay, how can we optimize the microbiome to make sure gums are not bleeding or receding by just doing these preventive little things?
Hi guys, I'm going to interrupt this episode for a brief announcement. As you may or may not know, I started a community for females by females, and it's a female longevity optimization community. This is a place that you can connect with like-minded women. We are all here to support each other, and there's a variety of different benefits to being a member. You get a monthly Ask Me Anything, so submit your questions and I'll answer them directly. We also have an entire library of courses on all of the important components of longevity, such as labs, nutrition, exercise, sleep optimization, longevity optimization protocols that I'm doing, along with real-time updates to my personal protocols. There are so many benefits of being a member of the community. We'll also be doing in-person live events here in California and virtual events for anyone that can't attend. But if you're interested in joining the community, I would absolutely love to see you there, and I will include a link in the show notes. I am obviously looking at everything from biomarkers. I have no makeup on today because I'm doing a skin longevity protocol where I've been doing these lasers and exosomes and PRP. It's like I want to address the mouth the same way that I'm taking action on all of these other fronts. And I feel like that should, it's exciting because you're thinking of it that way. But I think most dentists, unfortunately, are maybe not. So I am also going to I'm excited about this. So I have a little bit of a small mouth, just genetically, I suppose. So we're going to do some aligners, and my teeth are relatively straight, but we're going to make them perfectly straight. And you said it could even pull out the teeth a little bit, which in a good way. You can explain more because that probably sounded good.
Yeah, you explained it great, actually. Yeah. But one of the things, we always look at the way the teeth come together. We call that the bite, how the teeth come together is important because it really allows you to wear your teeth more evenly throughout life. And if your bite is optimized, now you're not going to wear more side versus the other. And also one of the things we see, if your bite is optimized, you don't get the recession also that you might be getting if you have too much pressure, let's say in the premolar sides.
Yeah, that makes sense.
Yeah. So with the digital technology that exists today, when we do the clear aligners, we can actually look to see where your bite is going to end up. And we can make tweaks and also look to see at the wear patterns, over the years by just taking photos, and look at the wear patterns of also the gum, like how is the gum wearing down as well.
I love that. Well, we have a full YouTube video on step 1, part 1 of my oral optimization. We kind of went through just a little bit of the consultation that we had. I was prepping for my wisdom tooth removal that day, which honestly was so easy. And I'm so excited that it's out. And so you can review the YouTube video if you're interested. And we're going to do another one whenever we get to the aligners. I can't wait to feel like my bite is a little bit wider and more balanced, so I'm not wearing anything down unnecessarily.
Yeah, I'm excited that you're sharing this with everybody, because if you would have gone, let's say, to a traditional dentist, they would have looked in and said, "You look fine.
I know.
Go home."
I know. Trust me, I know. Well, first, if I went to a traditional dentist, I probably would have gotten a dry socket, and then I would have some infection. Sorry for dentists that may be listening, but if you are a dentist listening, you should maybe consider biological dentistry. But
Yes, and one of the things that I'm starting for the community, also, Kayla, is some courses.
love that.
Because now that I practiced for 20 years and I'm going to continue to practice, I really was thinking about what kind of legacy do I want to leave behind. And I feel like, after 20 years of experience, I look at things maybe differently, and really I'm able to put everything together in a way that might be easier for the younger generation of dentists to pick this up.
Yeah, I love that.
Plus, I actually gave a lecture a week ago to a dental community. It was about nutrition and wellness and oral health, and we had a great turnout. And the sad part is how many dentists came up to me telling me they're not feeling well.
Wow.
That they're sick because they're inhaling all the toxins, from the dental office, and they don't know what to do.
Wow.
A lot of autoimmune issues, brain fog, Parkinson's from the heavy metal. So
Jeez.
I think...
I'm not surprised. But
Yeah. So all the dentists listening to this is not, for your patients, but it's for yourself, just be healthier and learn and just be more conscious about the things that you choose.
Absolutely. When it comes to nutrition, I would guess avoid sugar. It's probably good for your teeth, right? Excess sugar, at least.
Yeah, that's true. But, you can indulge in a little sugar ones, and especially the natural.
Yeah.
Everything, in limitation. Like if you want to have some dark chocolate, it's okay. But yes, the problem with sugar is it's also the form that it comes in. Let's say sticky things. So actually, let's say having some honey or like a sweetened drink is actually not as bad as cookies and crackers that stick to your teeth that actually will feed the biofilm that's naturally present on the teeth to cause cavities and this acidity in the mouth that can cause loss of enamel.
Wow. I heard something about, though, because I would always brush my teeth right after I finished eating, but I heard something about the enamel is slightly softer after eating and you should wait. Is there any truth to this?
There is some truth to it, but there's only certain foods.
Okay. Like, is
So,
it
for
like
example,
cakes and crackers?
Cakes and crackers, no. You can actually, if you brush right away, it's the best.
Okay.
Get the sticky food off your teeth the soonest you can.
Yeah.
Either, if you're at a restaurant and you can't get up and brush your teeth, you can just take a drink of water and swish it rapidly in the mouth and swallow it. You can do that. But wine, for example, I like to have a glass of red wine once in a while. And
Not me, but okay.
yeah. So those people out there who actually drink anything acidic, or it could be lemon water, do not brush your teeth after drinking lemon water for at least 30 minutes.
What about steak and vegetables? What if you eat steak?
Steak and vegetables are no problem.
Okay, good.
Yes.
I was worried that I was hurting my enamel.
Yeah, no, that's no problem. It's the acidic things. Lemon, limes, fruits, pineapple, for example, or any kind of acidic drinks are a problem. They acidify the mouth or temporarily. The saliva comes in the next 30 minutes to calm down the acid and remineralize the teeth. For people with dry mouth, they should wait even longer or actually even avoid lemons and limes.
Okay. Yeah.
Because they don't have the saliva to remineralize the teeth. And the people with dry mouth are people that have some autoimmune issues like Sjogren's syndrome, for example. Sometimes even as we age, our mouth can get drier. So in order to preserve the teeth, just stay out of the acidic food families.
Do you have anything else that people need to know about oral health? This will be an ongoing conversation as we continue to optimize my oral health for longevity. But do you have anything else that you want to add?
Yes, I do want to add one thing about sleep optimization.
Okay, good. I love that.
Because as we have the CT scans that we do now as an initial patient exam, we're looking at airway health and people with sleep apnea. What happens is if you have sleep apnea, you don't get enough oxygen to the brain, and that has a 47% risk of mortality.
Yeah, wow.
Good news is your dentist that's doing airway health can help with this. one of the best tools we have today is this night lace treatment that I actually treated my mom with. She had moderate sleep apnea. It doesn't involve numbing. This dentist from Florida, who's amazing, he developed this technique about 8-9 years ago using a laser. It helps to reshape the back of the throat.
Wow.
And people actually sleep better. It opens up the airway with no numbing and no downtime.
That's amazing.
Yes.
That's a game changer.
It is total game changer. I've been using this laser now for a year and I'm seeing really amazing results. And prior to this, I mean, people wear like a CPAP, which is this mask that goes on, which I think it just brings so many pathogens. Bacteria grows inside of it. So there are some recalls on these CPAP masks. And
wow.
Or the other option would be a surgery to cut out the back of the throat, which is very invasive.
That is. Well, that's a game changer. I feel like probably a decent amount of people listening have CPAP or have sleep apnea or know someone that does. So, I mean, if you're in LA area or California, I mean, Beverly Hills Dental Health and Wellness is where I'm going. I just absolutely love coming. It's also, your office is great. You get like ozone water and it's like very, you just feel amazing when you leave. So
that's our goal, to get you to feel good.
And yes.
And healthier.
Yeah. Well, thank you so much for being on.
Thank you, Kayla. Remember, the mouth is the gateway to your health.
I know it is. So I hope everyone prioritizes that. And if you're in LA area, then definitely see Dr. Sanda. What is the website that if people are outside of California and they're trying to find a biological dentist?
If you're in any state or even outside of the state, there's IAOMT. It's an International Association of Oral Medicine and Toxicology, IAOMT.org.
Okay.
And you can find a biological dentist in your area.
Thank you for sharing that, and thank you for being here.
My pleasure. Thank you for having me.
This podcast is for informational purposes only, and views expressed on this podcast are not medical advice. This podcast, including Kayla Barnes, does not accept responsibility for any possible adverse effects from the use of the information contained herein. Opinions of their guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.